The pupils of your eyes do much more than simply react to light. They serve as a window into your brain's health, reflecting changes that may signal underlying neurological conditions. By observing pupil behavior, scientists and doctors can gather important clues about how well your brain is functioning. Subtle shifts in pupil size or responsiveness can indicate issues ranging from stress and fatigue to more serious disorders. This connection makes pupil examination a valuable, non-invasive tool in assessing brain health. Understanding these links helps us appreciate how closely our eyes are tied to our overall well-being. The pupil is the dark, circular opening at the center of the eye, surrounded by the colored iris. Its primary function is to control the amount of light that enters the eye, helping to protect the sensitive retina and optimize vision. When exposed to bright light, the pupil constricts, becoming smaller to reduce light intake. In dim conditions, it dilates, allowing more light to reach the retina. This automatic adjustment is known as the pupillary light reflex. Beyond light, pupils can also respond to emotional states, focusing efforts, and certain medications. Together, these responses help maintain clear and comfortable vision in a variety of environments. Pupil dilation and constriction are regulated by intricate neurological pathways within the body. The size of the pupil is primarily controlled by two opposing muscles in the iris, the sphincter pupillae, which constricts the pupil, and the dilator pupillae, which enlarges it. These muscles receive signals from the autonomic nervous system. The parasympathetic branch, originating in the Edinger-Westphal nucleus of the midbrain, triggers constriction, while the sympathetic branch, starting in the hypothalamus and traveling down the spinal cord, causes dilation. The brain continuously processes visual and environmental information, adjusting pupil size in response to changes in light, emotional states, and even cognitive effort. This dynamic control helps optimize vision and protect the eyes from excessive light exposure. Pupil reactions can reveal important information about the state of your nervous system. When your pupils dilate, it often indicates increased alertness or a response to low light, but it can also signal activation of the sympathetic nervous system, which is associated with stress or excitement. Conversely, constricted pupils may suggest relaxation, exposure to bright light, or activation of the parasympathetic nervous system, which promotes calm and rest. Abnormal or sluggish pupil responses could point to underlying neurological issues or imbalances. By observing these changes, healthcare professionals can gain insights into your overall nervous system health and detect potential problems early. The size and responsiveness of our pupils can provide important clues about the health of our nervous system. When pupils do not react normally to light, or if there is a noticeable difference in size between the two, it may indicate an underlying neurological issue. For example, after a concussion, abnormal pupil responses can suggest brain injury or increased intracranial pressure. In neurodegenerative diseases like Parkinson's or Alzheimer's, changes in pupil function can reflect disruptions in the pathways that control automatic bodily functions. Careful observation of pupil behavior is therefore a valuable tool for clinicians in diagnosing and monitoring these conditions. Pupil assessment is a vital tool in clinical settings, providing doctors with important clues about a patient's neurological health. By shining a light into the eyes and observing the pupil's response, clinicians can quickly evaluate brain function. Changes in pupil size, shape, or reactivity may indicate underlying issues such as increased intracranial pressure, brain injury, or nerve damage. These tests are often performed during routine examinations and in emergency situations to help guide diagnosis and treatment. The information gathered from pupil assessments can be crucial for monitoring changes in a patient's condition over time. Overall, this simple yet effective test plays a key role in the early detection and management of neurological disorders. Pupil behavior can be influenced by a variety of factors. Certain medications, such as those used to treat allergies or depression, may cause the pupils to dilate or constrict. Emotional states like fear, excitement, or stress can also trigger noticeable changes in pupil size as the body responds to different stimuli. Environmental influences, including changes in lighting or exposure to bright screens, play a significant role as well. Understanding these factors is important when assessing pupil reactions, as they can provide valuable insights into an individual's overall health and well-being. Recent studies have revealed a fascinating connection between the way our pupils respond to light and our cognitive abilities. Scientists have found that subtle changes in pupil size can indicate how well our brains are processing information, especially during tasks that require attention and memory. These pupil dynamics are not only markers of cognitive performance, but also provide insights into mental health conditions. For example, irregular pupil responses have been observed in individuals with anxiety, depression, and other neurological disorders. By monitoring these changes, researchers hope to develop new, non-invasive methods for early detection and intervention. This emerging field highlights the potential of using simple physiological signals to better understand the complexities of the human mind. Monitoring your own pupil responses can be a useful way to stay aware of your eye health. Start by observing your pupils in a well-lit mirror, noting if they are equal in size and if they react to changes in light. If you notice that one pupil is consistently larger or smaller than the other, or if your pupils do not respond to light, this could be a sign of an underlying issue. Other warning signs include sudden changes in pupil size, persistent double vision, or difficulty focusing. If you experience any of these symptoms, especially if they are accompanied by headaches, vision loss, or other neurological symptoms, it is important to seek medical advice promptly. Early evaluation can help identify and address potential problems before they become more serious. In summary, your pupils can offer valuable insights into the health of your brain. Changes in pupil size, reaction to light, or unusual movements may reflect underlying neurological conditions or shifts in cognitive function. By observing these subtle signals, it's possible to detect early warning signs of certain disorders, such as Alzheimer's disease or brain injuries. Paying attention to your pupils can therefore play a role in maintaining overall brain health. While these changes are not always cause for concern, staying aware and consulting a healthcare professional when needed can make a meaningful difference in early detection and intervention.